Every college catalog shouldn't have a picture of a surgeon under an operating light on the first page. The profession is so enormously rewarding with all the systems involved that we can become expert in. We
To
got
that point,
problems.
Bryan, I wanted to bring up one thing we had talked about before. Where do you feel the dermatoscope is in this process, integrating it into our practice? Do you feel it's the stethoscope for our derm exam as podiatrists?
Well, it can be. The dermatologists feel that way. The problem is not that. The problem is the internists and the family practitioners and the nurse practitioners are lining up at seminars to learn how to do that. And podiatrists are not.
About AI and using different types of photo programs that might have an algorithm. What is your opinion on that? Where are we with that
It,
development?
it's coming. I don't know where we are with it, but it's definitely coming. We have a new device called a derm sensor, which is using some of that technology. But it's not about, it's all about getting a lesion out of somebody in the earliest possible stage.
Scope ads
Oh, or with the
curative. Give
naked
me
eye.
three
So
scenarios.
when you're looking at a tan to brown band with your naked eye, it looks like a stripe. When you put the dermatoscope on it, you see 6, 7, 8 stripes within the stripe. And depending on if those bands are parallel to each other or of different widths and intensity of pigmentation, that is your first sign of in situ melanoma. So that's a very valuable one. In addition, you can see leaching of pigment onto the proximal fold a lot earlier than waiting for the so-called Hutch